Dr. Roland Morales, welcome to our show. You're like a Renaissance man, plastic surgeon, professional bodybuilder. Mm-hmm. You're a photographer.
People started like looking up to me and say, hey, how do you do this? How do you do it when you're a plastic surgeon? How are you training and find the time?
What is a typical day like in the life of Dr. Morales?
I train every day. It's either cardio or weight training. I weight train 6 days a week. So I did 45 minutes of cardio this morning.
You have the Morales Foundation.
Yeah.
So in some cases, it's got to be, exhausting, right? What is your mission? On that note, what are you passionate about?
Welcome to the Labrada Show.
Welcome back, everybody. My guest today is one of the country's most successful cosmetic surgeons and a trailblazer in the use of plastic surgery for not only female physique athletes such as wellness, bikini, and figure competitors, but also male bodybuilders. He is the real deal. And that's because he's not only a successful cosmetic surgeon, he is also himself an IFBB classic bodybuilding professional. This is a man who walks the walk. And he's written papers on cosmetic surgery procedures that have been published in medical journals. He's been the recipient of multiple awards and accreditations, including the MyFace, MyBody Awards, NEWSWEEK Top Plastic Surgeons, Ultimate 100 Global Aesthetic Leaders, Texas Super Doctors, and more. Can't name them all. He's become known in the fitness industry as the Fitness Doc, and he's recently launched the Fit Doc podcast. Dr. Roland Morales, welcome to our show.
Thank you, Lee. I really appreciate it. Man, just one opportunity. I just want to thank you for the time to have me on your podcast. I mean,
it's so great.
I'm just so honored.
So great to have you here. Yeah. So I know that just visiting a little bit of your history, I know that you credit your dad with having inspired you to become a plastic surgeon. And I know because we've talked before that your dad used to create customized silicone replacements of noses and ears and other things to help people. So can you tell us a little bit about that background?
Sure. Like I've people ask like when I want to become a plastic surgeon. It's really basically when I can remember. And so I grew up, had more artistic talents with my dad gave me, genetically. And I grew up drawing and playing with anything I could use my hands with. And my dad was a medical sculptor at the Galveston Shriners Hospital down here in Galveston, about 50 miles south. And that was his first and only job, right out of, he was actually still in school when he got that job. He was an apprentice under the gentleman who was a medical sculptor at that time. And so in the Shrine Hospital, the medical sculptors are tasked to make the silicone prostheses for the burn children, the silicone prostheses for pressure garments and things like that. And so every child that goes through the burn hospital ends up seeing the medical sculptor. And so, my dad worked there for 40 years. This is his first and only job. And he literally touched every child that went through that hospital for 40 years. He had a huge impact on the aftercare of the burn children. And I just want to be my dad.
He sounds like an amazing man.
He was the best. I mean, he was, young boys, and you see your dad doing these cool things and making things and just creating, and you're over there trying to do everything your dad does. And he would take me to his office, during the summer, and I'm over there trying to make a silicone ear and nose. He's teaching me how to do this, and that's when I got introduced to plastic surgeon. The plastic surgeons work with my dad intimately. Like they would ask, "Hey, Roland, can you make this for me? Hey, we got to do this. Can you make this prosthesis?" So we get molds of the kid, and they'd be doing all these crazy things on them. But the plastic surgeon would be coming and looking at me, and I'm over here playing with making a silicone ear, and they're like, "You're going to be a plastic surgeon one day." And that's kind of.
So they actually told you that.
They told me that,
and that inspired you, I'm sure.
And absolutely, and I was like, I want to be just like you, Dad. And he's like, "Dad, your son, you're going to be just like me, but more. Wow. This is what you're going to do." So
what an incredible feeling. I know you guys were very close.
Very, very close. And, that's kind of what set me. And I just, kind of had my laser beam set on that, be a plastic surgeon one day, do what my dad did, but at a higher level. And so that's kind of where I just, I knew how to get good grades in school. I had to work hard.
It's not easy. You have to really, really study hard. You did all of your studies at the University of Texas.
I did. Was very fortunate to go to University of Texas, really from undergrad through medical school. I chose my medical school to work alongside basically my dad because UTMB is very intimately related to the Shrine.
So you actually got to work with your dad as part of the study. Yeah. That's incredible.
Isn't that a cool thing? So first day in medical school, went to class. Guess first thing I did, I went straight to my dad's office, and guess who was there? One of my mentors.
He had to have been so proud.
Oh man, some of the mentors that I grew up, idolizing with my dad, working on new prosthesis. And it was so cool to be in the Shrine with my mentors really in surgery. And then I was very fortunate again the residency there as well. Cause I chose that because again, I wanted to work alongside my dad. And so what was really cool for me, there's a couple instances where I grew up with some of the children that my dad took care of. And I actually took care of them as a surgeon at the Shrine, doing, reconstructive surgery for them in a reconstructive setting.
It has to be so gratifying to be working with kids and helping kids to get their life back together after what would be a catastrophic incident like that.
Very much so, to give them a little bit, some of their function back from the burn injuries that they've had, the deformities that they had, losing their ears, eyes, nose. I mean, reconstructive surgery is just one of those things that, it's definitely creative, it's artistic, but it's also very functional. It gives back so much confidence to children, so they can have, somewhat normal lives in the future. And you're only working with kids at the Shrine. And so I took that very personally. That's kind of one of my inspirations. I'm sure we'll talk about that later, but to give back to my roots of why I wanted to be a plastic surgeon.
That's right. And so you talk to us a little bit about how you went from becoming a medical student and studying plastic surgery to actually getting into your practice.
I went to medical school, obviously at the University of Texas, and did my training there as well. And so for plastic surgery, what we do, there's two routes. You go through general surgery of 5 years, and then once you finish your 5 years of general surgery, then you do a fellowship in plastic surgery, which is usually another 3 years. I was very fortunate to get into the accelerated route. So right out of medical school, I went right into plastic surgery. Much more competitive to get into those kind of programs. But
okay, so I have to ask you. So the first time that you're out of school now, you're a bona fide plastic surgeon, you're board certified. The first time that you operate on a patient, what's that like? The very first time, were you nervous?
Right out of medical school, yeah. It's kind of when it all comes together for you,
right?
Where you kind of see. I mean, I've already kind of saw my path, but to live it, that's really an incredible experience. And my first case was actually with my mentor, and that, I mean, he saw me growing up. I mean, he was one of the first one that told me you're gonna be a plastic surgeon one day. So that to me was what meant everything.
And so your first case was with your mentor. In other words, you guys were doing the case together.
Yeah.
How cool is that?
Yeah. It was it's the best.
It's amazing. Dude, I'm sitting here looking at your arms. You are in great shape. Yeah. So
look at you. I mean,
Thank you, man. Tell us how you got into working out. I mean, were you working out all the while through medical school, or when did you get bitten by the bug?
I guess officially probably at 3 years out of when I came out to private practice. But I've always weight trained all my life.
Right.
Played football, did powerlifting in high school. I graduated high school at 112 pounds because my coach felt that I was too good to gain weight, and I was really good at where I was. And then we went to college. Corey and I met right before we went to college, and you have a beautiful wife, Corey. Thank you.
And she competes, and she's a women's fitness pro,
figure pro.
Sorry,
she's
figure
also pro.
And so that's got to give you a just a totally unique perspective that you can bring to your practice with your female clients.
I think we have a little more understanding of athletes,
right?
And so when you're married to an athlete and they understand how to eat and train, and you understand the sacrifices, but the consistency it takes to be a bodybuilder and take care of your physique,
right?
It makes a world of difference. I mean, I couldn't do the things I've done and I would like to do without Corey by my side, because she understands me. She really understands me. She understands my ambition, my drive. The level of consistency I have to maintain to not only maintain my body, but to maintain, our quality of life and what we believe in and love.
I love to hear that.
Yeah.
I love to hear that. So you have experience as a classic bodybuilder, obviously, and you got your pro card. Tell us how you got your pro card.
Oh, this is a great story. You're gonna love this.
Okay.
So Corey and I have been competing at the NPC level. We went to the nationals. It was our third years at the Universe. And that's the pinnacle, right? To get your pro card,
right.
And What
does a pro card mean to you?
I mean, every bodybuilder wants to be a pro card. You get your pro
everybody
card.
wants to be a pro.
Everybody wants.
It's
to be
not
a pro.
just the card. Everybody wants to be a pro.
It's an elite status. Sure. Like there's only maybe 1% of the world becomes a pro.
Right.
Competes at an amateur level. But Corey competed on a Friday, and I had to compete on a Saturday. And she got a pro card.
Did you guys both become pros on the same weekend?
The same show.
No way. You became pros
The
at the same show.
2019 Universe.
Oh my God.
So she got her
That
pro
must have been a
card on-
celebration.
Oh my gosh, you should see some of the videos we had. But she
Right.
got it. I'm one screaming that like an idiot on the stands. So she really would have wanted it. And I was, already in my career and everything like that. So it's just a hobby for me.
Right.
But she got the pro card on Friday, and then she's like, oh, so no pressure. Like,
Right. No pressure. Now we're pros. Now we got to take it up a
so
notch.
thankfully, I was very fortunate to earn my professional status on Saturday the next day. And I mean, that's one of those kind of dream situations. You don't hear that very often, where a couple actually turns professional on the same weekend at the same show.
That's amazing.
It was a lot of
You're
fun.
like a Renaissance man. Okay. Not only are you a plastic surgeon and an artist because you sculpt flesh, but you're also a professional bodybuilder, and you're a photographer. You're like a Renaissance man.
I like to do things.
Yeah.
Keeps me busy.
That's right. You're a creative guy. So how did you become known as a fit doc?
Basically, when I got into bodybuilding, Corey and I got into bodybuilding in 2015. She got into bikini first. She did an NPC bikini, and she really enjoyed it. And she's like, the next show I want to do it with you. And I was like, well, yeah, sure, I'll give it a shot. And then I got to mingle with the athletes, got to meet, the women who were competing. And then, Corey went through this, transformation of, pretty significant weight loss. And then she lost a lot of breast tissue. And I was like, wow, that's where I come in. So we did a breast augmentation with her.
So Corey, I look at Corey and she just looks perfect.
Yeah.
And so you said, was she heavy? Was she overweight? Did she have to
No, she
lose-
wasn't overweight.
Okay.
She was just, not, stage ready, right?
Right.
So she's not anywhere near her off-season, body fat percentage now. I mean, she's a lot leaner than she used to be. It's just a lifestyle of changing what you eat every day, right? That dramatically changes the metabolism, in my opinion, and it changes physique in many good ways. So Corey got into it, and then she brought me into it, and I enjoyed it. I liked the competitiveness of it. I liked the consistency of it. I liked the discipline of it. People started like looking up to me and say, hey, how do you do this? How do you do it when you're a plastic surgeon? How are you training and find the time? It's just setting your priorities, Lee.
It is. It's about setting your priorities.
Setting your priorities.
And we're going to be talking about that a little bit later because we want to know what your success secrets are, balancing your work and your life and being a successful person like you are. So let me ask you this. What are some of the most common surgical procedures? Let's talk a little bit about what you do.
Sure.
What are some of the more common surgical procedures that you have some of your female athletes like, wellness, figure and fitness, women? What do they come and they ask for mostly?
Sure. Mostly breast and body, as well as non-surgical procedures that we do. But for women who get really lean, typically they lose a lot of breast volume. It's, breast fat. And so volume enhancement can kind of change or improve some women's physiques and the way they pose and present themselves. They get a little more confidence. A lot of women have had children, so have some extra skin that, it's just loose skin. It can hide the physique, right? The contours of the abdomen and the waistline. And so that's where I come into play.
So cutting away loose skin.
Yeah, cutting away like a tummy tuck. And
does it work well? Or
Absolutely.
I mean, is it one of these things that's really not noticeable once they have it done?
Yeah, it's. I would say it's not noticeable. I mean, you have a tighter, smooth abdomen. We repair some of the damage done from having shoulder by repairing the muscles, and so they have more of a defined, natural, aesthetic six pack. You would say.
Right. Do you ever do any of the ab etching? I
do.
And what is the technical term for that?
It's called ab etching. That's kind of the marketing kind of
Okay.
term for it. But it's basically high definition liposuction at a very aesthetic level of the abdomen, typically for men. Typically for men, and the guys that
why is that? Why do men have a harder time, with the definition in between their abs than women? It's always befuddled me because I see these women physique athletes, the figure and the fitness and the wellness pros, and they've got really defined abs, right?
Yeah.
And that would bring tears to a Mr. Olympia.
Yeah.
It's amazing, right?
Yeah, I would agree with that. But you have to understand that the procedures I do are not to get you on stage. Those procedures, abdominal etching, is not to get you on stage.
Right.
The
Final
patients
touches.
who want that, are going to be Athletes that are not going to get back on stage anytime soon. They want to have a little bit more flexible lifestyle in their dieting and training. They don't want to eat the same food every day. They want to have a little bit of flexibility. So their body fat's can be around the 20% mark. Mm-hmm. But if I do abdominal etching on them, I can reduce their appearance for their body by 10%. Without changing anything about their diet.
Right, because a lot of athletes use the abs as the indicator.
Correct.
That, like, in other words, if your abs look like this, I'm going to estimate that you're about 10 or 12% body fat.
Exactly right.
So by taking the fat away from the subcutaneous layer, right?
Correct. It's in the subcutaneous layer. Just etch it. Removes fat in specific areas, so it enhances the muscular anatomy. And so just by looking at them, they could be drinking on the weekends. They could be partying on the weekends. Right. But it looks like they're leaner, right? So it's more of a procedure I offer to patients who typically are like personal trainers who are not going to get on stage anytime soon, retired athletes, track, fitness, whatever it is. For men, they typically want more of a six pack, so I can sculpt out the six pack and create that more of that V cut taper, bring in the waistline up just a little bit more to kind of give you the more of the athletic V taper shape. For women, I don't do a hard etch like men, which is a six pack. I usually call it a soft etch. Okay. And the soft etch kind of gives you the midline, from the belly button up, and just along the side of the six pack. And so it's a nice soft athletic look. So you can actually
contour it.
Absolutely. Yeah.
That's very interesting.
So it's a little
Never heard it described that way, a hard edge versus a soft edge.
Soft edge is I do that only for women. Women who want a hard edge, it just doesn't look
doesn't look the same.
It doesn't look the same. Yeah. It just looks wrong.
Gives them a too hard.
I like to give a very natural appearance. When people look at them like, oh, wow, you look in good shape. That doesn't look right.
Yeah.
That's very important.
Now, plastic surgery has become more popular, it seems, year by year with men.
Yeah, it is. Yeah. Very much so.
Whereas guys used to, just kind of, that's for women. Yeah. Now they're doing it more and more, right?
Of course. You don't see them posting about it or talking about it like women do. Right. But it is very, very prevalent. Yeah. For men, at least for my industry, like in my practice, we have one of the largest group practices in the country. I'm the number one male surgeon that does surgery.
Do you have them coming and flying in from all parts of the United States to see you?
Yeah, all over the country.
That's great.
But, as a kind of the Fit Doc brand, I attract more men that are into health and fitness, and they want to, look better and more fit. And so, like the chest surgery is called gynecomastia. It's not uncommon. And so that's one of my top surgeries I do for men.
Okay. It's corrective.
I do 2 or 3 a week at least.
Okay. So quite a few of those. Mm-hmm. Let's talk about the psychological effects for a second. Sure. To me, that's always been very, very interesting, because it would seem to me that you have to have a pretty good understanding of how different outcomes affect the psychology of the patient.
Sure.
Can we talk a little bit about that?
Absolutely. It's like patients who I feel like I should have a minor psychiatry. Actually.
I was thinking the same thing as I was preparing for this podcast. I was thinking the same thing. It's like Dr. Morales has got to have a degree in psychology because you got to run like the full gamut. People that are just ecstatic, and then people that look in the mirror and they don't see a difference.
Yep, you nailed it. That's exactly that's some of the frustrations, but also some of the rewarding aspects of what I do. But for me, when I meet people, it's more about setting real expectations. If you can set real expectations, it makes their outcome so much better because they are not going to be disappointed. So I hate disappointing people. I know what I can do as a surgeon, and I know how I can take care of my patients. I know they'll have a great result. But if they're asking me to do something that's just physically impossible, I'm just going to tell them, that's not realistic. I am not your surgeon if you think I can make you look like that.
Right. So you have people come in and say, hey, make me look like Brad Pitt.
Along those lines, right? Someone who's like 110 pounds and they want to look like a wellness pro.
Right.
Like that is not going to happen. It's just not going to happen.
Yeah.
And so to tell them ahead of time, that way we don't go through the surgical process and they go through the disappointing, because then you have issues with sometimes you get depression and frustration. They get really angry.
Because they didn't quite. Right. And a lot of that is just perspective.
Absolutely.
Because you can do a perfect job and this person thinks it's the best thing since sliced cheese, and this one, is still disappointed. But that's a perception problem, and I think that's
agreed.
That's in their head, right?
Absolutely.
Yeah.
Especially I would say in bodybuilding, one of the most prevalent psychological disorders is called body dysmorphia. Mm-hmm. If you don't know what that is, basically you get, I think we all have it as professional bodybuilders. I think.
Right.
So you get used.
You always want to get bigger.
You always want to get bigger.
Yeah.
Right? You want to get leaner.
That's right.
You kind of get hard on yourself, and
it's the nature of the sport.
It's just the nature of the sport. It's actually inherent. It's actually bred into us, I think.
Right. But it has to be harnessed. In other words, it has to be a controlled obsession, because otherwise it does give you, like you said, dysmorphia. Basically an unrealistic self-perception, right?
Yeah, absolutely. I mean, you've seen athletes, really go kind of almost self-destruct. I mean, I've witnessed it. I've seen some of my patients who I've worked with, they go into bodybuilding, and then it just kind of snowballs, and they go into a kind of a downward spiral. Yeah. And to kind of pull them out of it, it's just kind of have to kind of shake them like, listen, you look amazing. You look great. Look at all the things you've done. All the hard work you've done. Look at all these people you're inspiring.
Isn't that something?
It's
you
incredible.
can have a guy that looks like he could be on the cover of GQ, or a woman that looks like she'd be on the cover of Vogue.
It's still not good enough.
And still think that they're not very attractive.
I know.
I mean, what's up with that?
You tell me.
Yeah.
I mean, it's one of the downsides to the sport that I see, and I really try to be a little more attentive to that when I work specifically with athletes in bodybuilding, of seeing those traits of that issue with body dysmorphia, where it can be toxic, in my opinion.
Right. Yeah. Well, and I know that you do a good job of consulting them and giving them realistic expectations. What is a typical day like in the life of Dr. Morales?
Well, case in point today. So I train every day. I'm sure you do too. But I train every day. It's either cardio or weight training. I weight train 6 days a week. Today is, I call my off day. So I did 45 minutes of cardio this morning. Wake up at 5 o'clock in the morning. I'm off the whatever cardio at 5:45. Eat breakfast for 30 minutes. I kind of prepare for my cases for 10 minutes, and I make my way into surgery center. 7 o'clock, I'm doing surgery.
By 7 o'clock every morning.
7 o'clock, I start at 7.
You're right. So everything is just set. Okay.
These are things we prepare for, obviously, for the procedures. I know what's coming, and I have all my notes and everything like that. And, I've done this so many times, it just got more efficient at it. So between cases, I have about 15, maybe 20 minutes to see the next patient, and then kind of review. What do you do for those 15 or 20 minutes? Because it has got to be just, in some cases, it's got to be, exhausting, right? I've just gotten used to it.
Yeah.
You kind of get used to the whole process.
We just think that
I'm
the amount of intensity, the focus that it requires.
Yeah. There's a lot more mental intensity and focus that I would think the layman would kind of underappreciate during surgery, for sure. For surgery, but between cases, as long as I get to sit down and just kind of get to be distracted by other things, but I'm actually working, actually. So I'm doing emails, I'm doing stuff on social media, I'm talking to my fellows, I'm teaching my residents. It's really, for me, nonstop while I'm eating.
So you're actually teaching students of plastic surgery at the same time?
Surgeons, or the resident surgeons.
You're mentoring them.
I'm mentoring them. I have 2 fellows right now I'm training for aesthetic surgery, and they both had surgeries independently of us. They do their own cases, and I'm in there between my cases. I jump in and say, how's it going? What do you, any issues or have any questions?
So they're actually working on their own cases. Absolutely. And then you're supervising them.
Absolutely. No, I'm not supervising them.
Okay.
They're already trained surgeons.
They're trained.
So they spend a year with me to hone their aesthetic skills. So they spend time with us in surgery, kind of learning the craft of aesthetic surgery. But they have their own patients that they work with, and it's their patient, right? I'm just in there kind of, hey, how's it going? Cheerleading. Oh, that looks great. Those kind of things. I wouldn't do that. Make an adjustment there, maybe, take that suture out to see what that looks like. And so I'm not scrubbed in. I'm just, just an observer, just mentoring, basically. But it's fun to watch them. They get more efficient and more confident, and that by the end of the year, they're just singing.
Take care of business.
I'm telling you, it's one of the most rewarding things to see, as someone who likes to inspire people and mentor people.
What is your mission on that note? Because you like to inspire people. Sure. I know all about your different talents. What is your mission? What are you passionate about? What are you most passionate about with your practice?
With my practice, I just want to be the best I can be. I really, people don't think I actually try to be better at everything I do, but I actually do. I have yet to have a perfect surgery. gotten closer.
So is that what you strive for every day to, like, can you just make it a little bit more perfect?
Like not miss a throw. Just these are like little details. Like
Little
people
details.
who work with me, they'll probably pick. They know.
Now, how do you judge yourself? In other words, because is there somebody? There's nobody grading your work other than you. So you're. How do you know when you're making improvements?
Well, I mean, it's like bodybuilding, right? You're competing against yourself,
Right.
right? And I know what's perfection. I've yet to find my perfect game.
Right.
But I'm always striving for that perfect game.
Right.
Perfect efficiency of movement. So I'm very, my brothers and fellow will tell you that I really focus on efficiency of technique.
Okay.
And if you're efficient, you don't have to go fast. Just be efficient with your movements. There is no wasted movement, and you become faster.
It's almost like a choreographed dance.
It's a very, very, very choreographed dance, I would say, between not just a surgeon, but my assistant. I can do surgery with my assistant, my surgical assistant handling my instruments. We don't even have to talk. I just go like this.
You just know. They just know.
And goes, and I'm just going like
It's
this.
that smooth.
Suture, boom.
That's amazing.
Like that, boom. They're moving their hands to help me in certain positions. Like it's really just it's like a symphony.
Dancing with the docs.
It's pretty fun. Yeah. I enjoy it. Like I'm saying, there's nothing better that I can do that I actually enjoy and I love it. Like we're talking about this in surgery today. Like when if you won the lottery today, because the lottery is like going crazy right now, like what would you do? I'm like, well, I don't know, probably maybe go to Dubai on the Emirates plane or something like that, come back after 2 weeks and go back to work.
That's right. Because you're passionate about it.
I just love it.
See, I'm the same way. It's like,
it's not work.
I can't imagine not doing what I do because it doesn't feel like work.
It doesn't feel like work.
It's something that I get up and look forward to every day.
And that's what I hope people who watch me maybe can be inspired. Like, I think there's something for everybody. I think you can find something that you're very passionate about and that you can enjoy and hopefully help people. That's what I enjoy. I like helping people. I like inspiring people, motivating people, and it should, and I'm proof that it can be done. Like,
yes, you are.
Yeah.
Success factors. We touched on that earlier.
Yeah.
So I'm coming back around to that. So what would you consider are the key factors to developing successful habits? What are your success habits? Or if somebody came to you and said, Roland, can you give me life advice? Can you give me, advice on, habits that will make me successful? What would you tell them?
Oh, there's so many things, Lee. I'm sure you and I do the same thing too.
Yeah. But
just,
I want to hear yours.
All right. Well, I would say just never give up. Never give up. Don't listen to people who don't listen to naysayers, like Arnold says.
Right.
I read that book very young. I was like, man, this guy's awesome.
Yeah.
He has a lot of great principles of life. I learned a lot from Arnold in that book. But and just work hard. I mean, that's such a cliche, but the reality is you don't have to be the smartest person in the world. You just outwork everybody.
You have to be persistent.
Very persistent.
I've noticed
very
that
persistent.
That is a key trait in successful people is that they're persistent.
Persistent.
And I've always said that if you persistently work at something, there's no such thing as failure because a failure is only temporary if you learn from it and you learn something and you can improve your game for the next time. That's it just comes with the territory.
Discipline, consistency, those are key words for me. It's just stay focused. I mean, it's amazing what you can do, and if you just the first thing you wake up about, you start kind of setting goals for yourself. Like, what am I going to do today? I'm a huge goal setter. I have some big goals, I have some small goals for the day.
And you have daily goals.
Daily goals, right? So these are all things I'm constantly working at.
Do you keep lists?
Of course I do.
Of course you do. I suspected that, but I just want everybody to hear it.
I think it helps me.
I think all successful people keep lists, right?
I look at those lists every day. Right. So it's always on my head. Like, what am I going to do this year? I know exactly what I'm going to do this year.
Do you look at the list like the night before? Like this is what my day looks like.
I look at it 3 or 4 times a day.
Okay.
To be honest with you. I'll be very honest with you.
Yeah. I do the same thing. That's really interesting. So let me shift gears real quick. Anybody that's watching us talk today, if they want to come in and see you at Morales Plastic Surgery, what can they expect to go through? What would that process be like?
Typically, you'll have maybe make a phone call. You'll call to our call center, and you get scheduled into a called consultation appointment. And at that consultation appointment, you'll see me at the office, which I have an office in the Galleria. And the first person you meet is Miss Linda. And Linda's my coordinator. She's been with me for 8 years. And she knows basically everything I know, right? Basically. And she knows all the procedures I do. She knows all my specializations. She knows all my words and everything like that. But what she's really good at is she can relate to patients. And that's what's really, really important. She's had a lot of these cosmetic surgeries done for her, breast, body, face. And so she can relate to patients who are interested in these things. And she can, just reinforce some of the desires, what bothers them. Like she's been there, she's done that, right? So you have someone to kind of relate to and give them honest, advice. Linda, if you ever meet Linda, she's not trying to sell you anything. She's not trying to, she wants to help you just like I do. I'm here to help you. So when you come and see me, I'm not going to mark you up and just start going to town on you. And so you tell me how can I help you? And I'm going to give you options, right? If I tell you you're not going to need something, I'm going to tell you you don't need something. I'm not there for the money. I'm just really not. That is not my MO. You can ask Linda, you can have anybody who asks me. I'm not there for the money. I'm here to actually help people.
That's one of the key success traits that I have found as well, is that if you just start out and you take the position, the paradigm that I'm going to create value for someone, I'm going to help someone, and the compensation will come along. And you contrast that to those that are just get focused on the money. They end up not being passionate about what they do. They end up doing a terrible job. And so I'm a big believer in that. I'm a big believer in finding something that you're very, very passionate about, and creating value. That's just so important.
That's a fundamental.
And it's very, very obvious you do that.
Very fundamental aspect. Like my dad told me, he's like, just do you do great work, be creative, be great at what you do, and the patients are going to come. They're going to be knocking down your door. And I've been very thankful to realize that now. And,
now, not only do you work on your patients, a lot of which are athletes, but also you do charitable cosmetic work. You have the Morales Foundation.
Yeah.
So tell me a little bit about the Morales Foundation.
So that's one of my big, dreams I have to do once in my career. And so I've been practicing cosmetic surgery, specialized in private practice for 10 years now. And financially, I'm ready to kind of ready to get back. I'm able to kind of step away from my practice a little bit to take the time off and really kind of contribute and push this through. It's something I want to do every year. It's going to be surgical mission trips in Mexico to provide reconstructive plastic surgery to children who their families can't afford it. And so
life-changing.
It's, the kids, these are kids I kind of grew up watching my dad do, right? So, syndactyly, which is, the hands are kind of fused together, the fingers are fused together, congenital ears, we have like the ears, mouth shaved, cosmetic or functional reconstructive surgery of the face and body. So we're going to start there. That's what we want to do. I'm going to be taking care of about 20 kids. So my first trip is going to be in April 12th to the 16th. So it's going to be while out of Mexico. It's in honor of my dad because it's really kind of, he passed a few years ago, but it's really, I wanted them to see it, see what, everything that I am because of really what he started and inspired me to become. And so I'm here. I've done it. I'm living the dream. And now it's time to give back. And I'm taking my fellows, I'm taking my residents, and it's an educational aspect for them. And then show them one day when you're out, you're going to do the same thing I'm doing, right? You got to give back. You are one of the top doctors in the country. They're elite specialty to be a reconstructive plastic surgeon. You're top. You're the best of the best. You owe it to society to give back, right? So let's go and do some good. And that's what we're going to do. So
that's a wonderful attitude.
Super excited to get started in my career. I'm hopefully 10 years from now, I'll be doing it twice a year. I'll be slowing down at that point, hopefully, and then I'll be taking my fellows and taking my residents. And so for me, it's going to be an educational way to mentor, upcoming fellows and residents and make an impact.
It's an amazing mission. I know your father would be very proud of you.
Yeah.
I want to touch base before we go on your new Fit Doc podcast. Tell us a little bit about that.
Well, just kind of seeing the evolution of YouTube and, all the podcasts coming out. I see YouTube as a future podcast.
Yes.
Because you have the component of the video component with the audio. And so that's how I've kind of taken a lot of information when I'm driving into wherever. I always end up watching YouTube, but I have the podcast. I'm listening to what they're talking about.
Right.
So for me, YouTube University, I spend a lot of time on YouTube University. I really do. But I learn everything about everything.
They say it is the world's second largest search engine behind Google.
It is, 100%. Like anybody follows analytics.
Can you imagine having had this when we were in school?
Telling you,
it's just amazing.
You can learn
the wealth of knowledge at your fingertips.
You can learn to do anything. I mean, I've watched podcasts on this topic specifically.
Really?
Oh yeah, it's out there already.
That's interesting.
So I figured, I'm YouTube. My YouTube channel grew by 278% last year. I was all in on YouTube. I had Chase and Lance, help me with it, and we just went all out on YouTube. So we did a bunch of series. Fit Dog Chronicles. It's kind of like, day in the life of Dr. Morales and doing what I do and doing different events I do, like the Olympia and these photo shoots I'm doing and my patient empowered photo shoots, interacting with patients, patient stories. And I think the podcast aspect of I want to find people who are very motivating. This guy.
Thank you.
Very much like you, right? That I know and who inspire me. Patients who inspire others, right? There's a lot of patients who've gone through weight loss or having 10 kids and have all these changes, and they're over there just being fit and healthy, and they're inspiring their family and their friends to be healthy and fit. And I think that's awesome. And so I think you got to bring their stories out into the public, and hopefully I have a fan base that actually listens to me and think I'm being honest and sincere, and hopefully I can kind of spread the word of inspiration and health and fitness and longevity of life.
I know you have a growing fan base.
Well, I'm trying.
and you are also a big supporter of the NPC and the IFBB.
Yep.
And you're a promoter. Mm-hmm. Let's talk about that just a little bit.
Sure. I mean, since I got into bodybuilding, in my industry, I've kind of supported the Texas NPC. And then once we got into the pro status, Corey and I started supporting the Olympia, started supporting the Arnold, and just got to know the network of the elite, I guess. Got to meet some really great elite athletes, Logan and Terrence and
Logan
Sivan,
Franklin, yeah.
And those are kind of my idols in classic physique, but figure and bodybuilding as well. Derek, I mean, those are really just amazing athletes, very inspiring people.
We have a lot of very inspiring people here.
Very much so.
In Texas.
I tell people that all the time. In bodybuilding, there's so many inspiring athletes. If you just get to know them. And so I had to, trying to get some of those athletes to kind of share their story, right? Because I feel that's where we have a little deficit in the sport, is that we don't really focus on the story of the athletes.
I think that people,
and we did one on you, right? We did a piece on you.
We did. It came out great.
Oh my God!
I would encourage you guys to go watch it on Dr. Morales' channel. What's the name of the YouTube channel?
Just Dr. Morales Plastic Surgery.
Okay.
Yeah.
Yeah. It was.
We did a feature on Lee.
Yes,
it was amazing.
Turned out great, guys. You need to see it.
Super inspiring.
Yeah.
So
I loved it.
I think we should be doing more of that. So
I think that storytelling is important.
Absolutely.
And people love stories. It's engaging. And I don't think I don't think that we should stop with just current athletes.
Right.
I think we need to talk about the roots of our sport. Bodybuilding and the like.
Right.
I think that's really important as well.
Mm-hmm.
Yeah. Good stuff. So how do our viewers find out more about you? Where do they find you on social media, your website, that kind of thing?
Sure, my website is just drmorales.com. Pretty straightforward.
drmorales.com.
And just, search me on YouTube. It's Dr. Morales Plastic Surgery. You'll find my channel there. I am the owner of Fit Dog Productions, which is, we specialize in really kind of bringing stories of athletes, focusing on transformation, inspirational stories and aspects of like the Fit Dog Chronicles, just kind of my day in my life. Instagram, I'm Dr. Morales _Fit Dog. So it's just the brand,
Doc, this has been so great today. I'm just so grateful that you were able to join me, and I think it was really inspirational for our viewers. So I just wanted to express my appreciation.
I'm so honored, Lee. You have no idea.
Thank you.
So honored.
Thank you so much. And you guys, if you will help us to grow the Lee Labrada Show by sharing this podcast with at least one friend, and be sure to hit not just the subscribe button, but the subscribe all button. Ring the bell. That way you will get all of my podcasts as they come out. So, all right, you guys, stay motivated, get up, look up. God bless you. We'll see you next time.
The Labrada Show.
Right before me. Thunder from a distant shore. Voices in my head, imprisoned.